Hello everyone, my name is Kaylee Hendrickson and today I will be presenting my research proposal on access to autism care in low-income communities. This topic is very important to me because of my background working with individuals with autism and my interest in improving access to care in undeserved populations. Autism spectrum disorder is a developmental condition that impacts communication, behavior, and social interaction. Early intervention and consistent services are critical for improving long-term outcomes. However, many children in low-income communities face significant barriers to access care. According to the Center for Disease Control and Prevention, about 1 in 36 children in the United States are diagnosed with autism. Despite this, access to services is not equal. Families in low-income communities often experience financial limitations, lack of available providers, and transportation challenges. These barriers can lead to delayed diagnoses and limited access to important services like applied behavior analysis, also known as ABA therapy. This creates a major issue of inequitable access to care. My research question is, how does socioeconomic status impact access to autism services for children in undeserved communities? My hypothesis is that children from low-income households will have significantly less access to autism-related services compared to children from higher-income households. The independent variable in this study is the socioeconomic status, which will be measured by household income level. The dependent variable is access to autism services, which will be measured by factors such as therapy hours per week, waitlist times, and the number of providers available in one area. This study will use a quantitative cross-sectional design to examine the relationship between income and access to services. Participants will include parents or guardians of children diagnosed with autism between the ages of 2 and 12 who live in low-income or undeserved communities. Participants without a formal diagnosis or outside of the age gap would be excluded. Data will be collected through an online survey distributed through autism support groups, schools, therapy centers, and social media. The survey will ask about income level, access to services, wait times, and barriers to care. To ensure ethical research practices, I will obtain informed consent from all the participants and keep all data confidential and anonymous. I will also avoid collecting any identifiable information. One challenge in this study may be reaching a diverse sample, especially families who may not have access to the internet. To address this, I plan to partner with the local organizations to provide paper surveys, offer multiple ways to participate, and ensure that all materials are culturally sensitive and easy to understand. I believe that this study can help social workers better understand the barriers families face when trying to access care for autism services. The results could support advocacy efforts for increased funding and resources, help agencies improve how they deliver their services, and inform policy changes related to healthcare access. The findings could be shared with social work agencies, schools, healthcare providers, policymakers in order to make positive changes. So these are the references that I used in order to help my research proposal, including information from the CDC, social work textbooks, and the NASW Code of Ethics. And last but not least, I would like to thank you for listening to my presentation, and I appreciate your time and consideration.